Hello everyone, welcome to my channel. Today we will discuss about vital signs examination or measurement. So here is some learning objectives. Describe the procedure used to assess the vital signs like temperature, pulse, respiration and blood pressure. Identify the factors that can influence each vital signs. Identify equipments routinely used to assess vital signs and identify the rationales for using different routes for assessing temperature. Vital signs, also known as cardinal signs of a body. Vital signs reflect the body's physiological status and provide information critical to evaluate homeostatic balance in the body, which include temperature, pulse rate, respiratory rate, and blood pressure. So, what all purpose we have to assess the vital signs? It is to obtain a baseline data about patient condition, or a diagnostic purpose, or a therapeutic purpose. So, what all equipment we needed to assess a vital sign? First is vital sign tray, which includes stethoscope, sphygmomanometer, thermometer, second hand watch, and red and blue pencil, vital sign sheet, cotton swab in bowl, disposable glove if available, dirty receiver kidney dish. So, what is the time to assess a vital sign? On admission, it has to be obtained baseline data of the patient. When a client has a change in health status or reports, symptoms such as chest pain or fainting, according to a nursing or medical order, before and after the administration of certain medication that could affect respiratory rate and BP, and CVS, before and after any surgery or invasive diagnostic procedures, before and after any nursing intervention that include uh, uh, that could affect the vital signs, or according to the hospital and health institution policies. So first vital sign is temperature. It is the hotness or coldness of the body. It is a balance between heat production and the heat loss of the body. Normal body temperature using oral is 37 degrees Celsius, or in Fahrenheit it is 98.6 degrees Fahrenheit. We can assess at two kinds of body temperature. Core temperature, first is core temperature. It is a integral organ. It is a temperature of integral organ, and it remain constant most of the time, like 37 degree Celsius, with the range of 36.5 to 37.5 degrees Celsius. It is the temperature of deep tissue of the body, remain relatively constant and measured with the thermometer. So next is surface temperature. First was the core temperature. Second is surface temperature. It is the temperature of skin, subcutaneous tissue, and fat cells, and it rises and falls in response to the environmental temperature. It can be ranges between 20 to 40 degree of Celsius, and it does not indicate integral physiology of the body. So we will talk about some alteration in body temperature. Normal body temperature is 37 degrees Celsius, and in Fahrenheit 98.6 degrees Fahrenheit. It ranges between 36 to 38 degrees of Celsius. Body temperature may be abnormal due to fever, hyperthermia, high temperature, or hypothermia, low temperature. Pyrexia is a fever. Body temperature above normal is called pyrexia. That is ranges 38 to 41 degree of Celsius. Hyperpyrexia, a very high fever such as 41 degrees Celsius to more than 42 degrees Celsius. Hypothermia, body temperature between 34 degrees Celsius to 35 degrees Celsius. Some common types of fever: Intermittent fever, the body temperature alternate at regular interval between the period of fever and period of normal subnormal temperature. Remittent fever, a wide range of temperature fluctuation occur over the 24 hour of period, all of which are above normal. Relapsing fever, short febrile period of few days are interspersed with period of 1 to 2 days of normal temperature. Constant fever is the body temperature fluctuates minimally but always remains above normal. Here are factors which can affect the body temperature. First is age, diurnal variations or circadian rhythm variations, or exercise, hormones, stress, or environment can lead the affect the body. Next is sites where we can measure a body temperature. First is oral, second is rectal, third is axillary, and fourth one is tympanic. Thermometer is an instrument which is used to measure a body temperature. So now we will talk about oral temperature. It is obtained by putting the thermometer under the tongue. Its measurement is 0.65 less than rectal temperature and 0.65 greater than axillary temperature. Leave 3 to 5 minutes in place. It is the most common site for temperature measurement. This is a site of inconvenient for unconscious patient, infant and children, patient with ulcer or sore in the mouth, patient with persistent cough. So, what are the advantages for the oral temperature? Some advantages easy access or patient comfort. Some disadvantages: it can lead to a false reading if a person has taken hot or cold food or any drink by mouth and also has moved. So we have to wait for at least 10 to 15 minutes after the meal or any smoking. So what are the contraindications for taking oral temperature? Patient who cannot follow instruction to keep their mouth closed. Child below 7 years, we cannot take a oral temperature. Epileptic or mentally ill patient, unconscious, client receiving oxygen therapy, client with persistent cough, uncooperative or in severe pain. Surgery of mouth nasal obstruction. If patient has nasal or gastric tube in place, we cannot take a oral temperature. So next is rectal temperature. It is obtained by inserting the thermometer into the rectum or anus. It gives reliable measurement and reflect the core body temperature. Hold the temperature in the place for 3 to 5 minutes to get a proper temperature measurement. More accurate, most reliable is more than 0.65 degrees Celsius, higher than the oral temperature because few factors can influence the reading. Some are disadvantages. Injure the rectum. It can injure the rectum. If it needs privacy. It is inappropriate for patient with diarrhea and anal fissure. Some contraindications: rectal or perineal surgery, fecal infection, infection, rectal infection, newborn infants. So next is auxiliary temperature. Auxiliary temperature, it is a safe and non-invasive. Is recommended for infant and in children. Some are disadvantages. It take long time for more than 5 to 10 minutes. Less accurate as it is not close to major vessels. Is considered the least accurate or least reliable of all the sites because the temperature obtained using this route can be influenced by the number of factors, that is bathing and friction during cleaning, It is the route of choice in patients that cannot have their temperature measured by the other routes. Next is tympanic temperature. So we have to place into the client's outer ear canal. We have to place a thermometer in uh, in the outer ear canal. It reflects the core body temperature. It's readily accessible and permits rapid temperature reading in pediatric or unconscious patient. It is very fast method. 1 to 2 seconds it takes to get a measurement. Disadvantages: it may be uncomfortable, involves risk of injury to the membrane. Presence of cerium wax can affect the reading, and right and left measurement may differ. So in this table there is a different route, normal ranges of temperature and site of taking a temperature. In oral, site of taking temperature mouth, normal range 98.6 degree Fahrenheit, and in Celsius 37.0 degrees Celsius. Tympanic membrane taking site is ear 99.6 degree Fahrenheit 37.6 degrees Celsius. In rectal temperature taken from rectum 99.6 degree Fahrenheit normal range, 37.6 degree is also a normal range. Celsius is a normal range. In axillary temperature taken in axilla 97.6 degree Fahrenheit and 36.6 degrees Celsius is a normal range. Now next is pulse. Pulse is a wave of blood created by the contraction of left ventricle. Pulse reflect the heartbeat, with a stroke volume and a compliance of arterial wall are the two important factors influencing a pulse rate. Pulse rate is regulated by autonomic nervous system. So peripheral pulse is a pulse located in the periphery of the body, that is example in the foot and the neck. In apical pulse, central pulse, it is located at the apex of the heart. The pulse rate is expressed in beat per minute, and the difference between the peripheral and apical pulse is also called pulse deficit. It is usually zero. Pulse is assessed for rate which is between the 60 to 100 beats per minute. Rhythm, regular or irregular. Volume, elasticity of arterial wall. The pulse is commonly assessed by palpation, which is feeling from finger, and auscultation by hearing using a stethoscope. So, what all factors can affect a pulse rate? First of all, age. The average pulse rate of an infant ranges from 100 to 160 beats per minute, and normal range of pulse in adult is 60 to 100 beats per minute. Sex. After puberty, average male pulse rate is slightly lower than the female. Autonomic nervous system activity. Stimulation of parasympathetic nervous system result in decrease in the pulse rate, and the stimulation of sympathetic nervous system result in an increased of pulse rate. Sympathetic nervous system activation occurs on the response of variety of stimulation, including like pain, anxiety, exercise and fever, indigestion of caffeinated beverages, and change in intravascular volume. Next affecting factor is exercise, fever, heat and stress. Pulse rate increases with exercise. In fever, increased pulse rate in response to the lowered BP that results from peripheral vasodilation and increased metabolic rate. In heat, in case of heat, increased pulse rate as a compensatory mechanism in the body. And in stress, increases the sympathetic nervous stimulation, which can increase the pulse rate. In position changes, sitting or standing position, blood usually pulls in dependent vessels of the venous system. Because of that, because of decrease in the venous blood return to heart and subsequent decrease in the BP and increase in the heart rate. So here are some medication which affect pulse rate, including digoxin, diuretics, and atropine and propranolol. Now the sites for pulse rate examination assessment. Carotid pulse at the side of the neck below tube of the ear. In temporal, the pulse is taken at temporal bone area. In apical, at the apex of the heart, routinely used for infant and children less than 3 years. In adult, thumb left mid clavicular line under the 4th, 5th, and 6th intercostal space. These are the sites for pulse rate assessment. So, in the continuation, brachial pulse at the inner aspect of biceps muscle of the arm or medially in the antecubital space below elbow creases. In radial, on the thumb side of the inner aspect of the wrist, readily available and routinely used in this. Femoral along the inguinal ligament used for infant and children. In popliteal pulse, behind the knee by flexing the knee slightly. Posterior tibial on the medial surface of the ankle. Pedal or dorsal pedis palpated by feeling the dorsum of the foot or upper surface of the foot. So in this picture you can see 4 pulse points where you can measure a pulse. Superficial temporal artery, carotid pulse, brachial pulse or radial pulse. Others are femoral. This is popliteal, posterior tibial, and dorsalis pedis. Pulse is a wave of flow created by a contraction of a heart in different part of the body. Now we will see a method of taking pulse. It is commonly used by palpation or feeling, or other is auscultation by hearing. The middle 3 fingertips are used with moderate pressure for palpation of all pulses except apical pulse. Assess the pulse for rate, rhythm, volume, elasticity of arterial wall. Normal pulse rate is between 60 to 100 beats per minute, or exactly is 30 to 80 beats per minute. In adult, pulse rate is more than 100 beats per minute is called tachycardia, and less than 60 beats per minute is called bradycardia. Pulse rhythm, it is a pattern and interval between the beats, random. Irregular beats is dysrhythmia. Pulse volume is a force of blood with each beat. A normal pulse can be felt with moderate pressure of the fingers. Full or bounding pulse, forceful or full blood volume destroy with difficulty. Weak, feeble, rapidly destroy with pressure from the fingertips. Elasticity of arterial pulse. A healthy normal artery feels straight, smooth, soft, and easily bent. Reflects the status of client vascular system. In continuation, if the pulse is regular, measure for 30 seconds and multiply by 2. If it is irregular, count for 1 full minute. Each heartbeat consists of 2 sounds, S1 and S2. S1 is caused by the closure of mitral and tricuspid valve, separating the atria and ventricles. S2 is caused by the closure of plutonic and aortic valves. The sound are often described as a muffled lub and dub sound. Next is respiration. Respiration rate is the act of breathing and includes the intake of oxygen and removal of carbon dioxide. Ventilation is also another word which refers to movement of air in and out of the lung. Hyperventilation is a very deep, rapid respiration, and hypoventilation is very shallow respiration. There is a two type of breathing: coastal breathing and diaphragmatic breathing. Coastal breathing is through thoracic, observed by the movement of the chest up and down, and commonly used for the adult. In diaphragmatic, it is also called abdominal breathing, involves the contraction and relaxation of the diaphragm observed by the movement of abdomen, commonly used in children. Factors which can affect the respiration: age, medication, stress, and exercise. In continuation, altitude and gender can also affect the respiratory rate. Fever increases the respiratory rate. In gender, men may have a lower respiration rate than women because men normally have a larger lung capacity than the women. In altitude area, the rate and depth of respiration at the higher elevation increases to improve the supply of oxygen available at the body tissue. During assessment of respiratory rate, client should be at rest, assessed by watching the movement of chest and abdomen. Rate, rhythm, depth, and special characteristics of respiration are assessed during the assessment of respiratory rate. Rate can be described in rate per minute. Healthy adult respiratory rate is 15 to 20 breaths per minute, is measured for full minute. As the age decreases, the respiratory rate increases. Eupnea is a normal breathing rate and depth. Bradypnea is slow respiration. Tachypnea is fast breathing. Apnea is temporary cessation of breathing. In continuation, rhythm is the regularity of expiration and inspiration. Normal breathing is automatic and effortless. In depth, described as normal deep or shallow deep depth. Deep respiration, a large volume of air inhaled and exhaled, inflates most of the lungs. In shallow breathing, exchanges of small volume of air, minimum use of lung tissues. Next is blood pressure. It is a force exerted by the blood against the wall of arteries in which it is following. It is expressed in terms of millimeters of mercury, like mm of Hg. There are two types of blood pressure: systolic pressure and diastolic pressure. Systolic is the maximum of the pressure against the wall of vessel following ventricular contraction, and the diastolic pressure is the minimal pressure of the blood against the wall of the vessel following closure of aortic valve, ventricular relaxation also called. In continuation, BP is measured by using an instrument called BP curve, a sphygmomanometer or stethoscope, and the average normal value is 120 by 80 mm of Hg for adult. Brachial artery and popliteal artery are most commonly used in the measurement of blood pressure. It is measured by securing the BP curve to the upper arm and thigh, placing the stethoscope on the brachial artery in the antecubital space or popliteal artery at the back of the knee. Pulse pressure is the difference between the systolic and diastolic pressure. Now, the factors which can affect the blood pressure is fever, stress, arteriosclerosis, exposure to cold, obesity, hemorrhage, low hematocrit, and external heat. Now, where we can measure a blood pressure? In upper arm, using brachial artery, which is commonest, and thigh around popliteal artery, forearm using a radial artery, leg using posterior tibial or dorsal pedis. In continuation, A persistently high BP measured for greater than 3 times is called hypertension, and if that is persistently less than normal range is called hypotension. Because of many factors influencing BP, a single measurement is not necessarily significant. When the cause of hypertension is known, it is called secondary hypertension, and when the cause is unknown, it is called primary or essential hypertension. What is the purpose of assessing a blood pressure? It can obtain baseline measure of arterial blood pressure for subsequent evaluation to determine the client hemodynamic status or to identify and monitor changes in blood pressure. So the equipment required for measuring a blood pressure is stethoscope, blood pressure cuff of the appropriate size, and sphygmomanometer. Now the procedure to measure the blood pressure. Explain the procedure to the patient and remove any light cloth from patient's arm. Make sure that the client has not smoked or ingested caffeine within 30 minutes prior to measurement. Position the patient on lying or sitting and standing position, but always ensure that the sphygmomanometer at the level of heart with the arm supported and palm facing towards you upward. After that, apply cuff securely around the arm, 2.5 cm above the antecubital space or fossa at the level of heart. Then palpate the radial pulse and inflate the cuff until the radial pulse can no longer be felt. This provides an estimation of systolic pressure. And inflate cuff 30 mm of Hg higher than estimated systolic pressure. Then palpate the brachial artery and place the bell of stethoscope over the site and earpiece on ear. Apply enough pressure to keep the stethoscope in place. Deflate the cuff 2 to 4 mm of Hg per second. The first pulse heard is the systolic reading, and continue to deflate until there is a change in tone of a muffled beat, which is called a diastolic reading. Then deflate and remove cuff roll neatly and replace. Record the systolic and diastolic pressure on vital sign sheet and compare the present reading with previous reading. Report and treat any changes with the health professional. Clear earpieces and bell of stethoscope with antiseptic swab and return all the equipment. Thank you for watching. Like and subscribe my channel.